Hello, and welcome to this recording of the Catholic Diocese of Fort Worth's Employee Benefit Package. Here at the Diocese, our benefit plan year begins on July 1st, so our current plan year will run from July 1st, 2023 through June 20th, 2024. Keep in mind that your deductibles and out-of-pocket maximums will reset on January 1st each year. The Diocese offers you and your family a comprehensive benefits package that includes medical, dental, vision, and life and disability coverage. Additional benefits include an employee assistance program, pension plan, and 403(b) retirement plan. The Diocese offers a PPO medical plan through Christian Brothers Health Services, and we use the Blue Cross Blue Shield network of providers. While the medical plan is flexible and allows you to choose both in and out-of-network providers, you will save money by staying in-network. Here is an overview of your PPO medical plan. The plan has a $500 deductible and a $3,500 out-of-pocket maximum. Primary care visits are simply a $25 copay, while specialist visits are a $75 copay. For non-office visits such as surgeries and hospital stays, you will be required to pay the deductible, then 20% of the remaining costs up to the out-of-pocket maximum. Remember that all preventative care is covered at 100%. Our medical coverage also includes prescription drug coverage through Express Scripts. And as with medical care, you'll save money when you use an in-network pharmacy. If you are utilizing maintenance medications, you will save money by using the mail order option through Express Scripts. If you fill your maintenance medication through the retail pharmacy as opposed to the mail order service, your copay will increase after the first 3 fills. Employees enrolled in medical insurance through the Diocese have access to Teledoc's telemedicine services. With Teladoc, you can talk to a doctor 24/7, 365 via your smartphone or tablet, all at no cost to you. Teladoc doctors can diagnose, treat, and prescribe medicine for many common illnesses. Some examples of illnesses Teladoc treats would be colds, flu, headaches, rashes, pink eye, and sore throats. Teladoc does include pediatric care if your child is on the health plan. Not just general medical, but also dermatology and behavioral health. If you are struggling with a mental health issue, Teladoc will be able to help with behavioral issues. Employees enrolled in medical insurance through the Diocese have access to My Catholic Doctor's telehealth services. With My Catholic Doctor, members have access to providers who practice medicine from a Catholic perspective. My Catholic Doctor provides services that go far beyond a typical telemedicine provider to include services such as virtual primary care, weight management, dermatology, mental health, Catholic second opinions, physical therapy, endocrinology, addiction recovery, physical therapy, speech therapy, and much, much more. All My Catholic Doctor healthcare professionals agree to practice in accordance with the ethical and religious directives of the USCCB, the Catechism, and the ethical position statements of the Catholic Medical Association. You can make an appointment on mycbs.org/health and clicking on My Catholic Doctor or by calling 888-822-8436. Employees should have insurance cards ready. Here is a look at your monthly medical premiums for the current year. As you can see, employee is $40 a month. Employee plus spouse is $503.82. Employee plus children is $373.35. And employee plus family is $774.49. We wanted to take a few moments to call to your attention the importance of choosing the proper site of care when experiencing a health issue. You have a lot of options when choosing where to go, so hopefully this does a good job of illustrating where to go depending on what you are experiencing. This chart arranges your options from lowest cost to most expensive and invasive. For many people, telemedicine is a great option since it can diagnose, treat, and prescribe medication for most of your common medical ailments. It's also the most convenient in that it is 24/7, 365, and is accessed through your smartphone, so you don't have to leave your house to have an appointment with a doctor. Similarly, My Catholic Doctor is a Catholic-specific telemedicine option that addresses not just general medical, but also behavioral health, obstetrics, family therapy, addiction, speech therapy, nutrition management, and much, much more. For most common medical visits, My Catholic Doctor will not cost you anything. For certain complex condition, there is a small out-of-pocket cost that aligns with your normal medical benefit plan. The next step up from there would be a visit with your PCP, who will diagnose, treat, and prescribe, but will also handle routine checkups, cancer screens, and general health management. Urgent care is more costly, but could be an option if you're injured and it's after hours. And the ER is your last resort when dealing with most medical conditions. It is the most expensive side of care both to you and the diocese. Of course, if you are in an emergency situation, such as broken bones, heavy bleeding, intense chest pains, please don't hesitate to go straight to the ER. However, in any other non-emergency situation, it is best to avoid the ER. We offer dental coverage through Aetna. Here is a quick summary of the dental deductibles and annual plan maximums. The Diocese offers a $1,500 annual plan maximum for our dental plan, and we cover orthodontia up to a lifetime maximum of $1,000. Our dental plan is passive, meaning that the in and out of network benefit levels are the same. However, the benefit will go further when you stay in network because of the superior discounts that Aetna has negotiated on behalf of their members. The dental plan is free to anyone enrolled in employee-only coverage. Dependent tier rates are shown here. All members who enroll in either the medical or dental plan are automatically enrolled at no cost in our discount vision plan through VSP. This VSP plan gives you access to discounts on exams, lenses, laser eye surgery, and more. The Diocese also offers a separate vision buy-up plan that includes greater discounts and more comprehensive coverage. If you want to enroll in this enhanced IMED plan, you must do so during your initial hire period, or you will have to wait until next year's open enrollment. Here is an overview of the IMED Vision buy-up plan. The plan covers exams and lenses every 12 months and frames every 24 months. It also provides much more robust coverage for bifocals, trifocals, and progressive lenses compared to the VSP discount plan. For employees who require vision correction, and certainly those who have had dependents with glasses and/or contacts, the IMED buy-up plan can save you a lot of money. Our FSA partnership is through WEX Health. As an employee of the diocese, you have access to a healthcare FSA and a dependent care FSA. The healthcare FSA allows you to set pre-tax money aside up to the IRS limit to pay for eligible healthcare expenses. The dependent care FSA allows you to set money aside to reimburse yourself for eligible dependents' care while you work. Recall that flexible spending accounts have use it or lose it rules as mandated by the IRS. Elections made for the July 1st, 2023 plan year will need to be used by September 15th of 2024. If you don't use all of the funds by September 15th, you will not be able to get any of the remaining dollars back. You must actively enroll this year to use either or both FSAs. You automatically receive $25,000 of basic life and accidental death and dismemberment coverage from the diocese. The diocese pays the full cost of this coverage. You pay nothing for it. You also have the option to elect supplemental life insurance for you, your spouse, or any dependent children. The amounts and limits are shown here and in your enrollment materials. As a new hire, you can elect up to $100,000 of supplemental life insurance and $50,000 of spouse life insurance without having to go through evidence of insurability. If you elect an amount above that, you will be required to answer medical questions. You automatically receive short-term and long-term disability coverage through the diocese, and both of these coverages are free to you as they are 100% paid for by the diocese. These benefits provide you with a portion of your income when you are unable to work due to an illness or injury. Short-term disability will pay 70% of your income up to a maximum of $1,000 per week. If you have greater than 80 hours of PTO, you will have to exhaust your PTO down to 80 hours before the STD payments kick in. So for example, if you have 120 hours of PTO when the elimination period ends and the STD payment is set to kick in, before you receive a check for your STD, you will have to use 40 hours of that PTO first. If you remain disabled after 180 consecutive days, long-term disability will kick in and pay 60% of your income up to $6,000 per month. Our Employee Assistance Program is a free and confidential service that can help you and your family with a variety of personal, family, life, or work-related issues and questions. This service is free, voluntary, and confidential. You can have up to 5 free face-to-face counseling sessions in addition to unlimited telephonic support. The EAP is available to all employees even if you are not enrolled in the medical plan. You automatically receive short-term and long-term disability coverage through the diocese, and both of these coverages are free to you as they are 100% paid for by the diocese. These benefits provide you with a portion of your income when you are unable to work due to an illness or injury. Short-term disability will pay 70% of your income up to a maximum of $1,000 per week. If you have greater than 80 hours of PTO, you will have to exhaust your PTO down to 80 hours before the STD payments kick in. So for example, if you have 120 hours of PTO when the elimination period ends and the STD payment is set to kick in, before you receive a check for your STD, you will have to use 40 hours of that PTO first. If you remain disabled after 180 consecutive days, long-term disability will kick in and pay 60% of your income up to $6,000 per month. The diocese also provides a pension plan. You are eligible to participate after you work 2 years, during which time you complete at least 1,000 hours of service per year. The participation is automatic. You do not need to enroll in order to participate. You should complete a beneficiary designation form to protect your family, however. No employee contributions are required or permitted. The entire cost of the plan is paid for by the diocese. If you work 20 hours or more per week, you are eligible to participate in our 403B retirement benefit. This allows you to put pre-tax money aside up to the IRS limits that you can use when you retire. You can contribute up to $22,500 per year into the 403B. However, if you are over the age of 50, you can actually contribute up to an additional $7,500 on top of the $22,500. For questions on any or all of our benefits, please use the contact information listed here. To enroll in benefits, log into ADP and complete the enrollment process. Your benefits will be effective on the first of the month, coinciding with or following your date of hire. This is your one chance to enroll in benefits without a qualifying event until next year's open enrollment. If you would like to sign up for the FSA, remember that you need to re-elect contribution amounts each year. If you have any enrollment questions, please email hr@fwdioc.org. Thank you.